Memorial Day weekend is the unofficial start of summer, and that also means tick season is fully underway. The number of tick disease cases has jumped 25% from 2011 to 2019, according to the most recent CDC data. The most common is Lyme disease, but health experts are also closely watching a rare disease that is spreading in the Northeast. It is becoming a bigger concern, something to watch out for here. CBS News medical contributor Dr. Celine Gounder joins us now. She is also editor-at-large for public health at KFF. Dr. Gounder, thank you so much for joining us this morning.
Great to be here.
So let's talk about this. Why are we seeing an increase already in these tick-borne diseases?
So we've seen this big increase over the last decade, and it's linked to climate change. So as you have warming of the temperatures, shorter winters, longer spring, summer, fall, when the ticks are active, you're going to see more transmission. You have more parts of the country that are also hospitable to ticks. And then you have other issues like deforestation, suburban, exurban neighborhoods being built in areas that used to be very heavily wooded, where you have a lot of ticks. And so the exposure is just getting greater.
Yeah, this is something we're worried about. We spend a lot of time outdoors. We're always finding them at this point. How concerned are you about this new illness, this rare tick-borne illness that's rising in the Northeast right now?
I think you're referring to babesiosis, which is another tick-borne disease. It has many of the same symptoms as Lyme disease, but in severe cases can cause kidney failure, lung failure, very low platelet counts. We have seen this on the rise, as part of all of the tick diseases being on the rise, and it is concerning.
What can you do to protect yourself?
Well, start by wearing long sleeves, long pants. Light clothing is better because you can spot the ticks on yourself.
I like colored clothing. All right, got it.
Things like insect repellents with DEET. There's a chemical called permethrin, which is a pesticide. We also use it actually to treat lice or scabies. Treating your clothing, your hiking gear with permethrin can be helpful here to reduce your exposure to
So in kind of the cost-benefit analysis between getting Lyme disease versus putting all the chemicals on your body to prevent the ticks from getting on you, you think put the stuff on you?
I would say, given that, yeah, cost-benefit for sure.
Okay.
Sure.
Oftentimes, Dr. Gounder, as you know, you're out in the woods and multiple ticks might land on you. You don't know it until you get home and you check yourself. How soon can you be infected with Lyme disease or this other disease once a tick gets its pincers into you?
Yeah, it takes about 36 to 48 hours for transmission to occur. So if you go out hiking, walking your dog, whatever it is, you come home at the end of the day and you check yourself, you remove any ticks, you're still in that window of, within 24 hours where you can really prevent your risk of acquiring one of these tick-borne illnesses.
And what about pet owners? And Nancy, I know you got
to talk about
your
proper
Instagram.
removal too.
Yes.
Yeah, like how do you
I have pets too.
For both humans and pets.
Yeah, so there are tick preventatives that you can give your dog or cat. You should talk to your vet about that to see what's appropriate. And then when you come home at the end of the day from walking your dog, check your pets for ticks all over. It can be a little harder to spot because of the fur.
Sure, but if you do find a tick on yourself, on your person, how do you get rid of it? Is it as easy as just pulling it off?
You have to be careful here. Use tweezers, and you want to get the entire body of the tick. You don't want it to break up as you pull it off. Don't use things like heat. Some people will try to burn it off or use Vaseline. That's not a good idea. That can actually increase the risk of infection.
So is it true that the mouth can be left behind if you're not careful, and then it just keeps there like nibbling? This is nightmare stuff.
And you can get an infection.
Yeah, exactly. So you really want to break it off, or pull it off, I should say, all whole together.
And should you be concerned if you see one that's engorged? I mean, oftentimes if you haven't caught one, you don't see it, it's filled with blood.
Is that too late?
Well, if it's engorged, it means it's probably been there for longer. And in that situation, or if you just think the tick may have been there for more than a day and a half or 2 days, I would contact your doctor to see, do you need to get a dose of doxycycline or some other antibiotic?
Ugh. Dr. Gounder.
Just wear long sleeve clothing.
Lovely to see you.
Tear off those gams.
Oh my gosh, yeah. So not this look.
Don't do what they're doing.
This is an invitation to the ticks, Vlad, by the way. You got one on your leg right now.